Good afternoon. We will call to order the Tuesday, February 22nd Insurance Subcommittee of the House. It is 1:40 p.m., and I apologize for my tardiness. Ms. Adams, if you could please call the roll.
Representative Sapicki? Hicks? Here. Kumar? Lafferty? Mitchell? Here. Rudder? Here. Smith? Here. Terry? Here. Thompson? Here. Chairman Hawk?
I am here.
You have a quorum.
Thank you very much. Committee members, do we have any personal orders before we begin business? All right, seeing none. We do have some action to, or at least some comments to make on the legislation before us, just to give you an idea of what we will be addressing today and will not be addressing today. Item 1 on your calendar, and these are requests of the sponsors. Item 1 on your calendar, House Bill 2262. We have a request to roll for 2 weeks. Without objection. Item number 2 on the calendar, House Bill 1772 by Chairman Powers. The request has been to roll this for 1 week without objection. We have item number 3 on your calendar, House Bill 2225 by Chairman Powers. The request has been to roll for 1 week without objection. Item number 4 on the calendar, House Bill 2862 by Chairman Dixie. The request has been to roll this item for 2 weeks without objection. We'll roll it. And item number 7 on our calendar, House Bill 2051 by Representative Lamar. The request has come this afternoon to roll this bill 2 weeks as well. Without objection, we will roll this bill for 2 weeks. All right, so that cuts our work down considerably today. We will go to our calendar, and Leader Beck, you are recognized. We are on item number 5 on our calendar. We have House Bill 685. Leader Beck, you're recognized.
Thank you, Mr. Chairman.
We have a motion and a second. Continue, please.
Thank you. This is a gig economy bill, very straightforward, very simple. We've seen a problem with young people and older people, adults, going out, getting in the workforce, delivering pizzas, delivering other items in this age of we all want it delivered. Many people don't understand that if you only have personal insurance and you're on a commercial errand, the private insurance can deny any claims for liability. In other words, if the pizza guy is doing his part-time pizza delivery, runs into someone and files a claim with his own insurance, if he does not have commercial insurance, his personal insurance can deny him. And we're having young people who are being stuck with, and I keep saying young people, but it's also middle-aged and older people who are doing this also for extra money. And they are being left, being sued personally, having debt for vehicles or damage and other things. And all we're asking in this bill is that if you're an employer and you employ or contract with for delivery of goods, then you shall notify, and you don't carry insurance. If you do carry insurance, you don't have to do anything under this bill for your drivers. But if you don't carry insurance, all you have to do is notify your drivers that they need to contact their insurance carrier or their insurance agent and speak with them to make sure they're covered, and if they're not covered, what type of insurance they need while they're out on a commercial errand. So this is for the protection of our working citizens. And with that, Mr. Chairman, I will be happy to take questions.
Thank you. Any questions of the sponsor? I do have a question. And I guess I'm thinking back to my old business, I hesitate to say law, but it was business law in my business major conversation. And at what point in time does the driver become an agent for XYZ, or is that related to your legislation anyway there, Representative Beck?
It's not related, but under contract, it's as soon as he gives them that pizza to deliver to 123 Maple.
Could you repeat that for me? I missed that answer.
Sure. As soon as the employer gives him the task to deliver that pizza to 123 Maple Street.
Okay. All right. Thank you. Representative Smith, you are recognized.
Thank you, Chairman. And if you would just walk me through this, this is a notification bill.
Correct.
Okay, notification bill. And then secondly, is it let's say that I work for DoorDash and you are the DoorDash coordinator for a regional area. Is it DoorDash that must inform the drivers, or is it, let's say that you have an exclusive contract with Robert's Bar and Grill on Broadway to run hamburgers and wherever? Or is it the institution? Is it the restaurant's job to inform them? Is it DoorDash supervisor, or is it the entity that's hired the drivers? Thank you, Chairman.
You recognize Representative Beck.
Thank you, Mr. Chairman. It is the institution that hires the driver. In this case, it would be DoorDash, not Roberts. Good question.
All right. Any other questions of committee members? All right. Seeing none, are you ready to vote? All right. All those in favor of sending House Bill 685 to full committee, please signify by saying aye. Aye. Any of those opposed, please say no. The ayes have it. House Bill 685 moves forward to full insurance committee.
Thank you, Mr. Chairman and committee. Mr. Chairman, on number 9, I need to roll that 1 week, please.
Or is that number 6 as well?
Number 6, I'm sorry, I didn't have my glasses on.
Yes. All right. The request, House Bill 1941 by the sponsor at the podium, has been to roll for 1 week. With no objection, your bill is rolled 1 week.
Thank you, Mr. Chairman and committee.
Thank you. All right. We are now moving forward to item number 8 on our calendar. Representative Hakeem. We have House Bill 2105. Representative Hakeem, you are recognized. Before we start, I'm sorry. Let me restate that. House Bill 2104 by Representative Hakeem.
All right.
We have a motion. We have a second. You are recognized.
Thank you very much, Mr. Chairman and committee. If you permit me, I do want to make a few comments, and then if you allow it, we have a couple of witnesses that we'd like to have, then I would come back with a few brief comments afterwards. First of all, I'd like to thank our governor, Governor Lee, for the block grant program that we have in place at this time. I'll use that term. It's a step in what I consider the right direction, meaning that people who have not been covered, or some are being, where they are being covered now, with the help of navigators or community activists who have assisted people in being registered in this process. We have someone like 1.6 million people who are now covered under this process. Taking the efficiencies that come out of this program, there was a split between the government, federal government, and state government that would ensure additional people where things like dental will be covered going forward. So we're saying that, in my view, there are positive things that are taking place under the program that Governor Lee has in place. But what it does not do or address at this time is that we still have 340,000 persons who are not covered under this program. And what our effort is to put into place an expansion program, the federal expansion program that would cover those persons. I know what we may say is that the program that is already in place gradually is going to get better, but people are sick, some may die, and what we're trying to do is to assist those persons in a better life now. And I'm talking both rural and urban communities where there's a need for us to have coverage now. At this point, we are one of 12 states that do not have not expanded the program so that all persons who are eligible would be covered. You know, you have some people, I think it's 118,000, who are in what they call the donut, you know, the wages that they make or the level they are in poverty puts them in a position where they just can't benefit from this. And so what we're trying to do is to put forward a program that was previously put forth by a former governor that would address dealing with the 340,000 people who are in need now. In my view, it helps when we deal with the economics of our state. If mothers have been staying home with their sick child, you know, long-term illnesses, this puts her in a position of getting back to work. Husbands who have been ill for a period of time who are not covered. Some people just don't know how to access the services that are available to them. And so the point is we're trying to put people back to work. We're trying to get our children in school and have a healthy state. We may look at some of the statistics. The state of Tennessee ranks number 5 in what's called the worst health position when it comes to obesity and what was the other? I apologize, I can't pull the other out right now, but we rank number 5. And so what we're saying is let's look at what can help people, our citizens, in both the rural communities and the urban communities. That's my opening remarks, Mr. Chairman, and if you deem it appropriate, we're going to bring forth our witnesses at this time.
Thank you. And I think Representative Smith would like to will make some comments right now. Representative Smith, you're recognized.
Thank you, Mr. Chairman, and thank you, colleague from Hamilton County. I'm maybe a little dusty here. Can you, or maybe this is a better question for TennCare, but can you define what a TennCare demonstration amendment number 25 is specifically? What is the population of people who would be eligible for that enrollment in TennCare?
Now, they may have to clarify more than I, but my understanding would be this is a program that was put forward, I can't remember how many years ago, 4 or 5 years ago, by a prior governor. And what it does, it would cover those persons in the donut, and it would also cover those persons who are in need who have not accessed the program at this point.
Representative Smith, you're recognized.
Thank you, Chairman, and I'll follow back up with TennCare or whomever is going to speak. But the question, the reason I'm concerned is, our TennCare roles continue to grow, and TennCare started out to be the means-tested insurance for the unemployed or the chronically poor. Now it's expanded even more, and I look at our tnjobs.gov website right now, and we have 457 and 595 current job openings. And so my concern is, I want to make sure that we're not incentivizing someone to remain unemployed. But thank you, Mr. Chairman. I'll follow up with the other presenters. Thank you.
Representative Hakeem, you're recognized.
If I might, I believe what this program would do, those persons, well, I think the average citizen wants to work. And if they are ill, if they are child is ill, that creates a hardship. So if that child is well, if that adult is well, they're willing to work. So I don't see it as a negative when it comes to what it can do for those persons who want to get back to work. I know the figures that my colleague spoke of, but I think this incentivizes people to get back to work, which is, in my view, what they want to do.
Sure, and I can address the Amendment 25 is an older TennCare amendment. What we're looking at with this legislation would to be create a waiver to that amendment. And much like we have several waivers that are requested of the federal government from time to time. So that is, I believe, what is being requested in this legislation. Any more questions or comments at the moment? Seeing none, Representative Hakeem, if you would, you've got a couple of folks that are on the list who would like to speak to Reverend Aaron Marble and Kanika Young.
Yes.
We'll take them whichever order they would like to come up.
Could I?
Certainly may.
Okay.
We will be limited to 3 minutes in your testimony, and if there are any questions and comments afterwards, we'll have an adjourner and be able to discuss at that point in time. I'm reminded to do it right this time that we will go out of session. And Reverend Marble, you are recognized. If you could, please state your name and who you're with, and tell us what you want to tell us.
My name is Aaron Marble. I serve as the senior pastor at the Jefferson Street Missionary Baptist Church, which is right around the corner here in Nashville, Tennessee. I want to thank you, Mr. Chairman, and certainly to this committee and to our representative for allowing us the opportunity to share with you all. Baptist preachers can sometimes be labeled as long-winded, but I'm going to stick within my 3 minutes today. I want to thank you all for the work that you do for our state and for the communities that you represent. And as a Christian, my filter of speaking with you all today is not one of Democrat or Republican, but it is one filtered through faith. Some of you may be Christian, some of you may not, some of you may have lives of faith, but I'm sure whatever your background is, faith plays a part and a role in your decision making and what you bring to your work to represent your constituents. And as we look at this bill and why I believe it is so important for us to further it into session and discuss it, is because when I look at Jesus Christ, I look at a figure and a leader who was transformative. And his transformative leadership impacts how I think our state and our communities should be modeled. In so much as far as that the scriptures teach us that sometimes for the common good, we might have to forsake or adjust or be flexible in what our own interests or opinions might be. And as it comes to this bill that would ensure some 340,000 residents of our state would be included for health insurance coverage, I believe that the transformative leadership of Christ informs us that this would be something that we should consider and discover. It's clear that the lack of access and affordability of health care is a problem for our residents, whether they be black or white, whether they live in urban or rural areas, whether they're men or women, whether they're our most vulnerable, our children or our elders, whether they are civilians or veterans, that affordability and access remains a problem. There are some 340,000 people that remain uncovered by the efforts that our governor has graciously helped to implement. There's still a group there that needs our help and that needs our assistance. And I think that as we look at what our faith would inform us to do, Jesus looked at a woman who was wrestling with an issue of blood for 12 years. The Bible tells us that she spent all she had, affordability. Also, there's another story in the scriptures of a man who stood outside the pool of Bethesda that was meant to be a place of healing and hope, but it was only for those that had access to the pool to get there first. And he was never able to do it, but Jesus helps him with access. And I believe we have an opportunity with supporting this legislation to help the affordability and to help with access to ensure that our residents are a part of the community that we desire for our state, one that's healthy, one that's whole, one that can get back to work, one that's beneficial for all of our residents. Thank you.
And thank you, Reverend Marble. And I will address just a few of your comments. I think I can speak for all the members on the committee that we are all people of faith. And we are. And we have very strong convictions on that faith, and we do allow that to lead and guide us. I will say that we have more folks on the teen care rolls than ever before in the history of Tennessee. We have expanded it over the last 2 decades after a disenrollment. I'll take that back. It's more like 15 years, but after a disenrollment that occurred roughly 15 years ago, where a couple of 100,000 folks unfortunately came off the rolls, and we propped up and created a safety net through our health departments, through many different mechanisms within state government to help folks through that safety net. We have since put many of those folks back on the rolls of teen care and have more folks on teen care than ever before. And we certainly are glad of that. The block grant that we have passed in the state of Tennessee, most recently in January of 21, is even going to allow us to bring more folks on in a gradual, financially responsible way. And I'm very comfortable and confident that we're going to continue. Your words are very well received, and I certainly appreciate where you're coming from, but I want you to know that each member up here is a man and woman of faith. We'll go on to Kanika Young. Ms. Young, you are recognized. You got 3 minutes. Please tell us who you are, who you're with, and what you want us to know.
Thank you, Chairman Hawk. Good afternoon, committee members. My name is Kanika Young. Hi. Okay, great. Good afternoon. I'm Kanika Young. I'm a lawyer and a health policy analyst. I'm currently employed with the Tennessee Justice Center, and I'm here today to speak with you in support of House Bill 2104, which would provide health insurance to hundreds of thousands of Tennesseans. The people who would directly benefit from this bill includes veterans, parents who live outside of the household with their children, women who are at reproductive age, people in rural areas, and people with disabilities. This bill would revive the Insure Tennessee plan that Governor Haslam proposed in 2015. It provides teen care to people who are below 138% of the federal poverty level and do not currently qualify for teen care. About half of employers do not offer health insurance to their employees. This leaves many working adults, including frontline workers, without affordable access to health care. Tennessee is one of only 12 states that have not expanded Medicaid. 38 states plus DC have expanded, and we can compare the outcomes in expansion versus non-expansion states. This natural experiment has provided more evidence that supports expansion. First, hospitals in expansion states are 6 times less likely to close than in non-expansion states. Tennessee has seen 14 rural hospital closures since 2010, the highest rate per capita in our country. Second, over 600 studies from 2014 to 2020 have shown the positive effects of expansion on measures such as access and utilization of care, positive health outcomes, and the state economy. Speaking of the state economy, the fiscal impact of Insure Tennessee is even more positive than it was in 2015. If the state expands TennCare, it would receive $1.4 billion per year of federal tax revenue to cover 90% of the costs. In 2015, the Hospital Association agreed to cover the 10% of costs that the state is responsible for. Today, the federal government has sweetened the pot by providing an additional $1.26 billion for 2 years if the state expands. After subtracting the cost of expansion, the state would net $900 million to spend or save as it sees fit. And these numbers do not include the increased revenue and savings the state would see as a result of having a healthier, more productive workforce, reducing long-term costs associated with uncontrolled chronic conditions, and lowering uncompensated care costs. This bill would help address the maternal mortality crisis, which disproportionately impacts Black people. It would expand access to mental health care and substance use disorder treatment, which have been exacerbated during the pandemic, and it would protect more people from medical debt, which is noteworthy because Tennessee has the 5th highest bankruptcy rate in the country, and medical bills are the leading cause of personal bankruptcy. These are just some of the upsides to expanding coverage, and after almost a decade of being in effect in other states, no downsides have emerged. So it would be in the best interest of all Tennesseans to advance House Bill 2104, And I thank you for your attention, and I'm happy to take any questions.
Thank you so much. Any questions or comments for our presenters? Sorry. Representative Mitchell, you're recognized.
Yeah, I appreciate y'all coming today. And Reverend, as our chairman said, I think we all are people of faith up here. But this has nothing to do with faith. This is just bad fiscal policy currently in the state of Tennessee. When you give up, I think it's about $8 billion at this point in time, it's malpractice by the legislature not to take this federal money that is Tennessee taxpayer dollars. Let's get it right. We're subsidizing 37 other states in this country for the health care of their citizens, while we're allowing our citizens to go uncovered until they get so deathly sick that they end up on the emergency room steps, and then it costs us a whole lot more than if they would have had care in the first place. So, I don't understand. I've told my colleagues we can. You said don't make it political. I want to make it political. I want to call it Conservacare, Republicare, whatever they want to call it. Take credit for it. Obama's been out of office 6 years now, so you can call it whatever you want now. But use our brains and let's get the couple of $1 billion a year coming into this state, and let's cover 300,000 Tennesseans. Please do the right thing. Like I said, take his bill away from him. We're all about bill-jacking in the Tennessee General Assembly. Somebody take his bill away from him, and y'all take credit for it and pass this, and let's give 300,000 Tennesseans health care, and let's get the Tennessee taxpayer their couple of $1 billion that they're owed from the federal government. Thank you.
Thank you. I was going to ask you to tell us what you really think, Representative Mitchell, but I think you did, and it's great that we have an opportunity to disagree with each other, but still like each other. So thank you so much. Any questions or comments from any other members? Representative Smith, you're recognized.
First of all, thank you all. As a former nurse and someone that's very concerned about healthcare policy, I know that your hearts are truly sincere, and I think that we all agree. And I even agree with my colleague, Representative Mitchell, sometimes that healthcare access is a problem. But where we find ourselves as a state, governments have no money. And that's a hard thing to understand, but this government has no money. We use other people's money to prioritize spending. And one of the fastest growing expenditures in this state has been health care, and the fact that we are enrolling more and more people. So essentially our state government is turning into an insurance company that educates some kids. And that's of concern. And I'm not opposed to leveraging buying power, but just do appreciate, I hear your sincerity. And I appreciate my colleague very much, because you know my heart working with you. But the reason I can't support something like this is not because it's not well intended, and not that it won't be helpful to someone. It's just that Davy Crockett got chastised long ago for spending someone's money that wasn't his to spend. And in the case of this, I think it would I'm all about innovation waivers, and I think that you're not off the mark. If we could find a way to equip citizens with a waiver to go purchase health care insurance or do something unique, like we've done, I know our chairman of the subcommittee has led on the Opportunity Act, and there are ways to work through workforce development and subsidize health care insurance, and I think that may be a possibility. So just know your requests are not falling on 10 ears. It's just that as a steward of this particular state's funding, we have to be more than an insurance company that educates children. So accept my sincerest thanks for being here, because I know your hearts are sincere. And I think we're all on the same team in a way. It's just we disagree with how to meet that the result. But thank you so much. Thank you, Chairman.
Thank you. Representative Thompson, you're recognized. Forgive me. Let's take a pause there, Representative Thompson, if I could. I think, Ms. Young, forgive me, and I should have looked to the dais. So you're recognized, Ms. Young.
Thank you, Chairman Hawk, and thank you, Representative Smith, for your comments. I appreciate the concern about being fiscally responsible, but I just wanted to clarify a couple of things. One is that the billions of federal tax dollars that we are not drawing down on don't go back to the taxpayers if we don't accept the money. It's still out of our pockets. Tennesseans are not benefiting from not accepting that money in any way. And then the second point I wanted to clarify is that in the Amendment 25 that Representative Hakeem has adopted for this bill, it has a component that provides premium assistance for people to do just what you were just talking about, which is to go and purchase private health plans on their own. And then the third thing I just wanted to emphasize from the question that you raised earlier about the available jobs that are currently on the market, about half of employers don't offer health insurance at all. And so having a job is not enough to be able to afford health coverage.
Thank you. And again, having lived through this for many, many, many years, I think the allure of the billions of dollars that have been mentioned from the federal level, regardless, there is a cost to our Tennessee taxpayers to draw those funds down. If it is 10%, if it is 5%, it's still a substantial amount of money that we look at on a recurring basis. And although we all feel giddy almost with the revenues that we're seeing across the state of Tennessee at this moment, there's no guarantees that those streams of revenue will continue. And 15 years ago, when Governor Bredesen had to disenroll over 200,000 people, it was because 91 cents of every new dollar was taking up residents in the TennCare program, and we could not sustain that financial model. Fast forward to where we are now, we are in better financial shape, and we've taken many measures to improve our financial status in the state of Tennessee, but we can't expect the funding we're seeing now in Tennessee to continue forever. And we have to be good stewards of the taxpayer dollars, as Representative Smith had mentioned before. Representative Thompson, you're recognized.
Thank you, Mr. Chairman. I guess in one way, we don't have money here. All the money that we spend here are other people's money that we've collected through the tax system. And we do this with the consent of the people, since, they elect us and they usually send us back, in most cases. So, this is other people's money, but they want us to take that money and spend it on things they look at as worthy investments in society. We're taking I don't know the exact number, but a lot of money to build roads and bridges and infrastructure in this state, and people like that. We spend billions of dollars on public education, the public education system, and people like that too. We argue about exactly how we will spend all this money, how we allocate it, where we might, whether we spend it on one place or the other. But we're obligated to spend that money and other people's money, so to speak. And everything you mentioned here, both of you, are worthy investments in Tennessee and society that we have here. And so I think that. It's been proven too, as you said, 38 states have this now, and they've been shown in one statistic after another to be worthy investments. And I believe it would be wise for this body to look at those worthy investments and approve this bill. Thank you.
Thank you. Any further questions or comments while we have our folks to testify? All right, thank you so much for being here. We certainly value everything that you've said and appreciate your comments. So thank you all so much.
Thank you.
We will go back into session. I got the nod of approval that I actually got us back into session properly, where I had some issues last week. Representative Hakeem, thank you so much. And as you continue, I want to thank your assistant, Michaela Martin, very much for the information that she has shared with us, which we have in turn shared with the committee.
Yes, sir.
Michaela's done a very good job, and I want to thank you to thank her. So, all right, we are back in session.
All right, thank you, sir. I'm going to try to hold to my word of being brief in my conclusion, but I truly, from my heart, want to thank you and the committee for hearing us out and expressing that concern that we feel is meaningful to the whole state, you know, whether it's rural or urban. And I guess in my closing, I want to bring out, I know this figure may not be accurate, but our state budget, I believe it's about 35% comes from the federal government. The affordable, American Rescue Plan, we receive billions of dollars. The infrastructure bill, we're going to receive those kinds of funds also. But when we talk about the health right now of our citizens, you know, we want to take more of an incremental perspective and just asking if we would look at considering taking those funds from the federal government and doing what we can for our citizens right now, as opposed to looking down the road. And Mr. Chairman, once again, thank you all so very much. I greatly appreciate it.
Thank you. Questions or comments of the sponsor of the legislation? Representative Mitchell, you are recognized.
Yeah, Representative King, I'm going to support your legislation because I'm tired of subsidizing the health care of Californians, New Yorkers, and the District of Columbia. So I'm going to try to support your bill and use Tennessee's tax dollars and Tennesseans' tax dollars and pay for health care for Tennesseans instead of people in California and New York.
Yes, sir.
Thank you.
Thank you.
Thank you. Any further questions or comments? Seeing none, you ready to vote? All those in favor of sending House Bill 2104 forward, please indicate by saying aye. Aye. Any of those opposed, please say no. No. The noes have it.
Thank you, Mr. Chairman and members.
Thank you.
Okay.
Any other business to come before the subcommittee? Once again, forgive my tardiness. I apologize. Thank you all very much, and we are adjourned.